Good afternoon, everyone. Good afternoon. This is Patience Font and Clicks coming your way again today with another topic. Today, I had told you the next topic and that the safe and effective care management or safe and effective care environment. The other topic I was going to discuss was assignment versus delegation. So today I'm talking about assignment versus delegation. So what is assignment? Assignment is allocating to healthcare team member work required to care for a group of individual. That's again I define is allocating to a healthcare team member some kind of work that is required to care for a group of individuals. So you are assigning something to another healthcare team member to do something, and that is part of the care. So the process is for you to determine nursing care required to meet client needs. Take into account the time required to accomplish that task, complexity of the activities, the acuity of the patients, and infection control. One giving out the assignment, the process for you to do or the process for you to give out an assignment is for you to determine the nursing care that is required to meet the client's needs. What kind of nursing care is required? Is it a higher level standard of care, or is just to check blood pressure? Is it an invasive nursing care procedure, or is non-invasive? And you also take into account the time required, amount of time that will be spent to accomplish that task, and the complexity of the activities. So the complexity of the activity comes with the qualification of the individual you are allocating or you are assigning to do that task. So you look at the complexity. Is it a complex procedure? Then you don't delegate it, or especially if the person is not in that scope of practice. The acuity of the patient. So you don't intentionally, you look at the acuity of the patient. The acuity is what's like the stability of the patient. Is the patient an acute patient? Is the patient stable? Is the patient unstable? So you look at how acute that patient is before you delegate. And infection control. So you also want to consider the knowledge and ability of the staff members. So the people you are working with, you have those that are nurses and you have those that are not nurses. You have a doctor, you have a PA, you have a nurse practitioner, you have a nursing assistant, you have an LPN, and you also have unlicensed assistive personnel. We also have community volunteers. Sometimes they come to work. So you want to know the knowledge level and the ability of the staff, and you decide which staff person is best able to provide that particular care. So if you are going to delegate somebody to go and help a patient with a bedpan, you should know. If you have unlicensed personnel, if you have nursing assistants, they will be the best to do that. And if you have registered nurses that you have to do something else and you have another critically ill patient, whatever qualifies in your job description, such a registered nurse in the same title with you can get the same assignment. But sometimes you also look at where the person is coming from. If the person is a floater, you don't give the person the acute patient. So you also take into account continuity of care. There has to be continuity of care. So you take account before you assign. Determine assignment to increase efficiency. So determine the kind of assignment to increase efficiency. You don't want it to be an assignment that will mess up the whole day to keep the staff there. Then you describe the assignment in measurement terms. So you want to tell the patient, you have to be specific about expected results. So you want to tell the one you are delegating the assignment to that I want you to help this patient. The patient wants to urinate, and I want you to help the patient with a bedpan right now. And when you get the bedpan, please measure the urine and let me know the measurements. And you record the time the procedure was done for me. This is the best way to give out assignment. So you are being specific about what you want the person to do, and you know exactly what you expect to get from that assignment you are giving out. So you have to be specific and you have to be time bound. Then you give assignment to staff members. You assign total responsibility for total care. Avoid assigning only procedures. So when I say go and do a bedpan, that's the total responsibility. I'm not going to have you to go and give the patient bedpan and I come and stand there. Then in that case, I have you come to assist me. You didn't come to do it. I have not delegated that to you. I have not assigned that to you. So if you give out the assignment, or the one giving out the assignment, you assign a total responsibility of everything about the bedpan and what the patient needs at this moment to the person, and then you provide additional help if needed. So this is why I tell you, if you have any challenges, let me know. If you have any problem, let me know. So if you go and the patient says no, you have to come back to me. So assignments will require you to provide additional help. Now, delegation. Let's look at delegation. Delegation is responsibility and authority for performing a task. Function, a task, and a task can be a function, activity, decision, and is transferred to another individual who accepts that responsibility on an authority. So it's a responsibility and authority for performing a task that is transferred to another person who accepts the responsibility and the authority to carry out the task. So the delegator remains accountable for the task. So if I'm the one delegating you, I am responsible for that task. So just because I put you in charge to do the one-to-one, I am still in charge of that one-to-one case. I am still in charge of every documentation. So I make sure that I delegated it to you for you to do it, but you have to get back to me with documentation. You have to get back to me with whatever requirement I had given you that is what I need. So the delegator remains accountable for the task. The delegator is the initial person who do the delegation, who give it out. So the delegator, the delegatee too, if you are the one accepting the authority and the responsibility, you are the delegatee. You are accountable to the delegator for responsibility that you assumed. You are accountable to me. So if I delegate the assignment to you, you are accountable to me. So you are the delegatee, I'm the delegator. Okay? So that's how it works. Let's continue. And can only delegate tasks for which the nurse is responsible. I cannot go and pick patient B who is not in my assignment and delegate that to you. No, I can only delegate assignment that is within my range, or that is within my responsibility. So if I'm responsible to 4 patients, I can delegate one of them for you to go and help them with activities of daily living. Now, definitions: responsibility, obligation to accomplish a task. So when we say responsibility, is the obligation for you to be able to accomplish a task. Accountability is to accept ownership for result or lack of result. So to be able to account. That's what that means. And in delegation, responsibility is transferred in accountability, and in accountability is shared. So in delegation, the responsibility I have is transferred to you. And when it comes to accountability, it is shared between us. You account to me. So we are sharing it. But in delegation, you had the total responsibility to yourself. Then you come and then we share the accountability. So when there's a problem and they ask me what happened on that fateful day you were doing the one-to-one, the patient fell down and broke his spine. What happened? I was the delegator. I have the patient. I am the nurse. I have to explain what happened. You are the one who was responsible for the one-to-one. You have to explain what happened. So both of us are accountable. Okay. Now the guidelines is can delegate only those tasks for which you are responsible. When you are delegating, that's what you should have in mind. So on the NCLEX, you want to think this way. So the question present to you, they will tell you which of the following activities will you delegate to this person. That means you are responsible. You are the one to be the delegator on the NCLEX. Or if you go, they tell you have floated to this unit. Which activity will you be able to take? They will tell you the specialty you came from. And then you know the kind of patients you are free to accept. And it should be something you should be able to accomplish, to fall within your your qualification, your knowledge level. So responsibility is determined by the Nurse Practice Act, defined scope of practice. So the Nurse Practice Act defines the scope of practice. They define what a registered nurse is supposed to do, what an LPN is qualified to do. So that's what the Nurse Practice Act do. It gives you the scope of practice. And the standards of care is established by the organization. So the standards of care, if the organization says, if the facility, that's the healthcare organization, is the facility decide that for every patient that come and is suicidal watch, we want registered nurses to sit with the patient. You have to sit. That's the standard. But that may not be the scope because it's already in your scope. But the facility allow you to put a PCA, somebody without certificate, to sit down so that you with the certificate and the professional qualification, you go and do a higher level task. You take care of other patients. So they wouldn't just hire you as a registered nurse to sit down. So the Nurse Practice Act providing the scope of nursing practice is a general one, but the organization have their established standards that they want you to meet. So get the difference. So if it's the organization that is assigning a particular task that you think this task could have been delegated, but the organization have it in their protocol, in their standard that this is what we do, that's what you should do. You cannot go against it. So NCLEX has it in their standard that when you are the nurse on the floor, you have all the time in the world to care for that patient. They are not limiting you. You have the reason to decide who to assign to whom. Now, the job description is defined by organization. So if you get hired in this particular nursing home, your job description is different. You get hired in another facility, your job description is different. So if you're a phlebotomy, you go for your phlebotomy job description. So if you are a nurse, you go for a nurse description by the organization. So they have where they want to limit you, and that is the defined job description by the organization. Policy statement from organization. So starting from the standard of care, job description, and policy statement, these are all organizational level tasks. So the organization does determine that. So mind you on the NCLEX, we have things that are standard for nurses and we have things that are organizational task defined. So in delegation, you want to think about all these things into consideration. You have to analyze your questions well. Must transfer authority, the right to act, along with the responsibility to act. So you have the right to act and you also have the responsibility to act. You must transfer authority in delegation. Empowers delegatee to accomplish the task. You have to give me the necessary information I need. So if you call me to come in and do something for a patient, you just don't say, go and take this for the patient. You have to tell me, who is that patient? Is the patient aggressive? Is the patient this? Is the patient that? You have to give me a little background information about the patient. So you have to help me. And if I am new and you are delegating me and you think I need access to the patient chat, are you letting me log in to be able to access the patient chat? You have to give me everything I need to accomplish that particular task for the patient. Now, the steps for delegation is to define tasks to be delegated. You have to tell me what it is. You can delegate only work for which you have responsibility and authority. You can delegate what you know best so you can provide guidance and feedback. Don't go and delegate acupuncture procedure to a PCA that you don't know, or to a nursing assistant that you don't know more about the procedure. You can delegate vital signs that you know how to explain best. You can delegate how to do a bedpan that you know how to do best. You can delegate how to make a bed that you know how to do best. Then you delegate what you know best. So you can, yes, and routine tasks, things that are routine, activities of daily living, tasks you don't have time to accomplish. These are tasks you can delegate. I don't have time to go and take the urine and go and do a dipstick. So you can delegate things like that. Tasks with lower priority. So it's not urgent, it's not life-threatening. So I can delegate that one. When it comes to a patient that needs intubation, I have to put in an IV line. I don't have to go delegating that one. So you can delegate things that are not life-threatening, lower priority. Determine who should receive delegated task. I have to determine who should receive a delegated task. Determine who should no, you also identify the task that is involved. Determine its complexity. So, do I need an LPN a little above than the unlicensed personnel, which is the PCA? So you define who. Then you match the task to individual by assessing the individual skills and abilities. Evaluate their capacity of performing of evaluate the capacity of the individual to perform that task. Do you have the capacity? Do you have the capacity as a nurse to go and do a finger stick? So if you don't have the capacity to go and do an EKG, if you tell me you're a CNA, you don't qualify to do, you were not trained to do EKG, I don't have any choice than to look for another person to delegate. So this is task that doesn't fall within your ability and your skills, so I cannot assign that to you. You consider the availability, the willingness to assume that responsibility. So that's another thing, but NCLEX usually doesn't give you some of those choices. You just need to delegate. You need to delegate. Then we have, before you can delegate, you need to provide clear communication about your expectations regarding the task, the answer, and then you can answer the person's questions. So you need to give a clear guidance of what you want to do. Then to also delegate, you assume a face-to-face position, you establish eye contact with the person, describe the task using I statement. I want you to. Don't go and say you want to. Okay, I want you to. So you use that statement. Then you describe the task, and then you provide what is it, when you want it, where it should be done, how of the task to be delegated, how it is that you want it to be delegated. I'm busy and I cannot be able to collect the patient urine to do a pregnancy test. So take care of that one for me. So when you get it, let me know the result and the time. And I need a lot number to also document. That's specific assignment. So you also want to state if the delegatee needs to provide written or verbal report after the task is completed. That's what I just said. If written report is needed, inform delegatee where to put the report. So when you bring the chart, when you bring the result of the pregnancy test or the urine dipstick, put it in front of my desk. Put it here on the chart, in the patient chart. Go in the computer and document. When you do the vital signs, document it. That's, we want to be so specific so that they know where they're going to bring out the result. But if there's a problem, you have to talk to me. Okay, so identify what changes or incident need to be brought to delegators' attention. So if client's BP is lower than this, so you want to tell them. So if you go and check and the blood pressure is lower than one, like is lower than this, you have a specific number. You think that if it's that number, the patient will not be doing well at that point. So if the BP is lower than 120, or if the BP is lower than 90, if it's lower than 50, if the diastolic is lower than 50, let me know. If the diastolic is lower than 60, let me know. So you want to go very specific so that when the person went to do the checks and realize that it's not lower, then they may not tell you, but they will tell you, oh, the blood pressure was not lower than what you told me. So you also provide reason for task, the reason why you need that task. You give incentive for accepting responsibility and authority. Literally, you can just say thank you. Thank you for accepting. You give incentives. I remember one of the bosses will always give chocolate, and I told him I don't want chocolate anymore. I need something different. I don't want chocolate, but it's a little incentive to say thank you for accepting the assignment. So you can give incentive. You tell the delegatee how and how often task will be evaluated. So if it's something that you want the patient, you want it to be a continuous assignment. So you tell the patient, I want you to check it back in 2 hours. Or the patient, the delegatee brings to you the finger stick and it's high, the blood glucose level and it's high. Then you give your intervention. Then you tell him, I want you to go back and check it in 30 minutes time. So mark your time and check the sugar in 30 minutes time and let me know what it is. So you describe the expectations, outcomes, and timelines to complete the task. So you tell them the expectations and the timeline that you want to complete that particular task. You identify constraints for completing the task and risk if there are any challenges. So you tell them the patient may not give in to you, the patient may be difficult to deal with, or the patient is a little aggressive. So you just let them know before they go. You identify the variables that will change authority and responsibility. Feed client if coherent and awake. So if the client is alert and awake, you can feed them before you do this. If patient is confused, do not feed and notify me immediately. So you can tell them something like that. So if you go and the client is awake and confused and not cooperating, do not feed them. Just notify me. This is a sample of how you should provide authority when providing assignment. Obtain feedback from delegatee to make sure he or she understands tasks to be performed and your expectations. Ask for questions, give additional information. You reach mutual agreement on every task that you are taking. You monitor the performance and result according to established goals. Give constructive feedback to delegatees. Listen, constructive feedback, sometimes people may feel offended, but constructive feedback are good because it does guide you, it does give you a clear directive. So you reach mutual agreement on every task. You confirm that the delegated tasks are performed as agreed. So if I give you the assignment and you don't get it, you have to follow up and then you understand it. But make sure it is done as we have agreed to do it. Then this one, you don't delegate and take control. You don't discipline issues. You don't discipline you don't like disciplinary issues. You don't delegate that one. Confidential task, things that are confidential. So the patient don't want anybody to know they are HIV positive. It's a confidential task. So you don't send anybody to go and tell them their HIV result, which is not even the nurse's scope. It's the doctors who carry out result to patient. It's just an example. Technical task, things that are a little technical and confusing. Controversial tasks, tasks that are controversial, nobody understands it. It's like everybody's trying to figure it out. There are little challenges, misunderstanding. During a crisis, when there's a crisis, you don't delegate tasks. So if the patient is dying, the patient is CAC, the ambulance just brought, and after intubations and everything, you don't delegate monitoring to anybody. You, the assigners, take care of all those tasks at that moment. So levels of delegation in ascending order. Now you gather information from delegatees so you can decide what needs to be done. So you want to gather information from your delegatee. That will tell you what you need, what needs to be done. You list alternative courses of action and allow delegatees to choose one course of action that they'll be able to accomplish. So if I tell you to help the client with urinary or a bedpan, then I also ask you to do a finger stick, then I'm going to tell you, okay, so get the finger stick first before the bedpan, or get the urine first before the finger stick. Do this. You have to group the activities. Okay, so you have the delegatee outline entire course of action for the task and approve it before proceeding. So you have them understand. If you have to write it down, then you tell them, I want you write down every task number 1. So you want me to do this, and I'll start the procedure like this. So you allow the delegatee to perform perform entire task using preferred method and report only result. So if I give you the procedure and you think this is the way you do it best, having infection control in mind, you can get it done, and then you bring the results to me. Rules for delegating: delegatee. Delegate to lowest person on hierarchy who has the required skills and abilities and who is allowed to do the task legally and according to the organization. So when you are delegating to the lowest person on the hierarchy who has the required skills and the ability and who is allowed to do the task legally and according to the organization's protocol or standard. So when you are a registered nurse and you want to delegate, you cannot go from being a staff nurse to delegating to your head nurse or delegating to your manager. You can only delegate people that are under you. Okay? You can delegate people that are under you. So get that right on the NCLEX. So when they start talking about delegation and prioritization, and they start talking about nurse managers, and the question goes to you, and your title is a registered nurse writing that exam, then you are not delegating to your child nurse. You can only delegate to the LPN or the nursing assistant on the floor. Obstacles to delegations. There are obstacles. We have the non-supportive environment, rigid organizational culture, lack of resources, limited personnel. So sometimes these are challenges. We have all, if you have worked somewhere before, which I believe we all have worked somewhere, we know that organizations do have challenges. The work culture is very rigid and strict. They are not flexible at all. The limited personnel, they even have short staff every time. So who do you get to delegate? That's the question. Now we have insecure delegator. So if I think that this task I'm delegating, it's not going to be done well, insecure, it's an obstacle for me, I may not want to delegate it because the last time you did a finger stick, the result, I don't know. But if the person is not trustworthy, you don't want to bother. Fear of competition, fear of liability. So I'm even scared that you go and cause trouble. So if I know you are the fighter type, you go and fight with the patient. And the patient is the argumentative type, you go and argue and cause trouble for me. I'll be afraid to delegate. Those are part of obstacles. Fear of decrease and personal job satisfaction. So you are fear of decreased personal job satisfaction. So I'm afraid that I will not be satisfied with the job you will do. Unwilling delegatee. So the delegatee I want to assign, she's lazy. She's not always willing to do anything. Fear of failure. So I'm afraid that you might be a failure in that task. You may not be able to do it right. Even though it's in your job description, but it's still my task that I'm trying to delegate. So inexperience or incompetence. This is mostly the problem with delegation in our facilities lately. Inexperience or incompetence. Even people that are supposed to be experienced and competent, they pretend to be inexperienced and incompetent. Ineffective delegation is under delegation. It doesn't transfer full authority. So this is when somebody doesn't really know the procedure to delegate well. So they don't transfer the full authority. They tell you to do this, and then you go and start. Before you know, they are standing there and they are talking. They take back their responsibility. They interrupt and fails to equip or direct delegatee. Some people just don't know how to explain things for others to understand. So they want you to do the procedure, but they don't have a specific mindset of what they intend to have you do. So when that happens, it does give you a lot of setbacks. So it is hard to cope with. You have questions that are competent of delegatee. So the delegatee will have a lot of questions, and ineffective delegator will not be able to answer their questions. So it is really hard. Reverse delegation. Lower person on hierarchy delegates to person higher on authority. So the first one we talked about was the lower person delegation, lower hierarchy delegation. Now we have the reverse, where the lower person is delegating to a higher hierarchy. We have chain of command. So under the chain of command, when it comes to the chain of command, you know where you fall in the organizational structure. So you can delegate things that goes for administrative purposes and things that goes for level behind you. So the right task. So we have the over delegation under this one. We have the delegator loses control of the situation by delegating too much authority and responsibility to the delegatee. So they are saying here that it is possible for you to delegate to somebody above your level, but mind you, all what NCLEX want to know is your ability to share tasks. They want to test your skills. You will hardly get so much questions under delegating to management or to higher level. They will only question your ability to follow the chain of command. The chain of command. So you should know that if I am a PCA, I report to the LPN. LPN report to the registered nurse. Registered nurse report to their charge nurse. Their charge nurse also reports to their manager. Okay, but the registered nurse can jump the charge nurse and report to manager based on what is going on, because you also have the same qualification at the same level and scope of practice. So we have the rights of delegation. We have the task, right person, right time, right information, right supervision, and then right follow-up. Unlike we have the 5 right, this now is 6 right of medication administration. We also have the right task, right person. The right person is the one with the knowledge and the skills and the abilities to do it. The right time is not in crisis. You don't delegate when it's in crisis. You don't delegate on stable patient. Right information, the correct information, the right supervision is tasks that are being performed correctly. You want to question that. Is that the right supervision? And then the right follow-up. So these are the right of delegation. We have the delegation empowers others, build trust, enhances communication, leaderships, it develops teamwork, and increase productivity. So it saves time on one person spending hours doing everything for one person when others are there. Failure to delegate and supervise properly can result in liability. This is legal nursing. It can result in liability. Need to consider delegatee competence and qualification. So if you go and delegate to the wrong person, it can cause problem. You tell the nursing assistant to go and give an injection, which they are not supposed to be doing, it is a liability. When they go and they cause a serious hematoma on the patient, or they go and inject on the nerve and it causes trouble, you can be liable. Here come the legal term. So you know their qualification, you know what they can do. You don't delegate initial assessment to LPN. So if you're LPN, they delegate initial assessment and you assess the patient and you miss stuff and then something happened. You, the delegator, becomes liable. Then nurses have a legal responsibility to make sure patients or persons under their nurses have the responsibility to make sure that persons under their supervision perform correctly established standards of nursing practice. So if I am the nurse manager, I have the responsibility of having all of you on the floor to perform your nursing practice according to the standards of nursing practice that is given to you. So it's a legal responsibility on the leader. So if you are the nurse on the floor, NCLEX takes you as the leader. So you have the legal responsibility to make sure that every assignment you are delegating, you are considering the scope of practice or the standard that has been established for nurses in that organization. Now, staff mix, combination of registered nurses, licensed practical or vocational nurses, and licensed assistive personnel. So they call the PCAs and the tax on licensed assistive personnel. They don't have certificates. So you want to note the difference. And then support staff combined to complete, not substitute for professional staff. Now let's look at the LPN. So the LPN assists with implementation of the defined plan of care. So if you're an LPN and you are taking these exams, take note of this portion. You assist with implementation of defined plan of care. Implementation of a defined plan of care, you assist. You perform procedures according to protocol. So every procedure you perform should be according to protocol. Differentiate normal from abnormal. Report data to RN. So if you're an LPN, you should be able to know the correct labs of a patient. Then you can differentiate the normal from abnormal and you report it to the registered nurse. Care for physiologically stable patients with predictable outcome. So if the patient is physiologically stable and has a predictable outcome, this patient is likely going to be discharged this afternoon. The outcome is predictable. You know that this is stable patient and it has a stable outcome. You care for that patient and you take care of that patient. So you have the knowledge of asepsis and dressing changes. So it's your responsibility to do dressing changes on the NCLEX. So NCLEX will question you. This is not nursing responsibility. LPN, it is your responsibility to do wound dressing changes. You can change the dressing. Okay, so don't think it's RN, it's you. LPN dressing changes is your responsibility. Because you have the knowledge of asepsis and aseptic techniques and how to do it. So you are expected to know. So go and learn this procedure under wound care and the type of wounds. You need to know the type of wound before you follow aseptic techniques. So this I'm stating to you are the differences you have with the RN. I really didn't state with the RN. All what they have been describing fall under the description of the RN. But now they are being specific. We're talking about the LPN or the vocational nurses. Excuse me. They have the ability to administer medications, and this one varies with educational background and state nurse practice act. So for every state that you are practicing, you have the ability to administer medication. That I know is almost in all 50 states of America. I'm not sure, but I am positive that LPNs are trained to give medication, especially non-invasive medication. PO medication, you go to the nursing homes, it's LPNs you see. So I know they do give a lot of medications. So it's in your scope of practice. Now let's talk about the unlicensed assistive personnel, the UAPS. That's the one NCLEX will use. NCLEX like that word. So the unlicensed assistive personnel, they are those I always refer as the PCAs, patient care technicians. They are the nursing assistants as well. So they assist with direct patient care activities, bathing, transferring the patient, ambulating, feeding, toileting, obtaining vital signs, patient height, patient weight, intake and output. So housekeeping, transporting, stocking supplies. These are what they do. So if you are delegating assignment, if you are an LPN, you can delegate any of these assignments. I mentioned them again. The nursing assistant or unlicensed assistive personnel, they assist in direct patient care activities. Bathing, transferring, they move the patient from the Hoyer lift is their job. Ambulating the patient, helping the patient to get out of bed and go to the bathroom. Feeding, toileting, obtaining vital signs, weight, height, the patient height, intake and output. They can get that for you. Then housekeeping. Housekeeping is when there is something spill and before the housekeeper come, they can do all of those minor stuff. Transporting a patient. So you have a patient moving from your unit to psych. You can go with them. So, and then you have a patient going for ultrasound. They can send the patient for you. These are stable patients. Stocking supplies. So when you need supplies on the floor, you know who to assign. Now, include nurses' aides. These people include the nurses' aide, assistant technicians, orderlies, nurse extendeds. So these are the people in this category. They are nurses' aide, nurses' assistants, technicians, the orderlies, and the nurse extenders. The scope of practice is limited. They have a limited scope of practice. So take note of their job description. So when you talk about activities of daily living, you can delegate it to these people. But mind you, on the NCLEX, you want to be able to understand what's going on with that patient first. You want to make sure the patient is stable because they do direct patient care. You don't delegate Foley insertion for them because they do urine output or they can do output and intake. You can only tell them, go and check the urine, go and drain the urine, measure it for me. That they'll be able to do. Don't delegate Foley care for them. Okay. Now, hierarchy of chain of command, organizational hierarchy designed to promote smooth functioning within a large and complex organization. So organizational hierarchy is designed to promote smooth functioning within a large and a complex organization. The hierarchy is employees are ranked according to their degrees of authority within an organization. So you are ranked according to your degree of authority in that organization. So we start with the management, but on the NCLEX, I limit you starting from the nursing staff to the LPNs to the unlicensed assistive personnel, and then that's it on the floor that they have. Okay, so the chain of command emphasis is on vertical relationship. Example is nurse reports to nurse manager, who reports to nursing supervisor. That's an example of a vertical relationship explaining the chain of command. So if you are a registered nurse, you report to the nurse manager. If you are an LPN, you report to the nurse. The nurse report to the nurse manager. And then the nurse manager also report to the supervisor. Nurse report variances, problems, and concerns to next person with authority in direct line in their area. So you don't get up from here, from your floor, and then you go to med-surg floor to go and report a problem, because that is not your line. You have crossed a boundary. Or you don't just get up when there's a problem, you leave your manager and you go straight to the chief nursing officer. Now we have critical thinking. I'm going to be ending my video shortly. This involves creativity, problem solving, decision making. The nurse responsibilities is to observe, to decide what data are important, validate and organize the data, look for patterns and relationships, state problem, to transfer knowledge from one situation to another, and then decision on criteria for evaluation. The next is to apply knowledge and evaluate according to criteria that is established. We have decision making, purposeful and goal directed. That is decision making, purposeful and goal directed. Nurses identifies and select options and alternatives. So you select an alternatives, you identify a problem, you try to weigh options, and then you select an alternative. The types of decision making are prescriptive, involve routine decisions with objective information. Routine decisions with objective information. So objective is what you voice out. So objective is what you are going to see. So you see that this is not the thing, but this is what we have been asked to do when a patient presents with this problem. I've been asked to follow this instructive or this directive. Options are known and predictable. So you already know what you are going to do in this decision. So in prescriptive decision, the prescription is a laid down format that you follow that has been prescribed. So they tell you if a patient comes with abdominal pain, you assess the abdomen, you get a particular problem. When you get a particular problem, you're going to need urine. You tell them to maintain NPO. It's already prescribed that you are just following. So decisions made according to standard of procedures or analytical tools. So they have the whole thing, the whole setup written down by the facility, and they want you to do. So that's prescriptive decision. Now behavioral, we have this one. It involves the routine and non-instructive information. Routine or non-instructive, it's not always the same. It's routine, often goes in line. Options are unknown or unpredictable. You don't know what is going to happen. This is routine. It keeps happening and you don't know the outcome. Decisions made are by obtaining more data, using past experience, using creative approach. Satisfying, or satisfying. We have the solution minimally meet objective, expedient use one time, and expedient use one time is an issue. So these are decisions you make when you have to rush into situations because of timing. So when you have a patient with STEMI or a patient having a heart attack or myocardial infarction, you make certain decisions that are satisfying. You are just doing it for the situation, and you are considering time as well. Now we have optimizing. Optimizing is the goal is to select ideal solution. Best decision comes from this process, but in most time it is consuming. Now we have the phases is to define objectives, generate options, analyze the options, identify advantages and disadvantages. You rank options. You select the options that will successfully meet the defined objective, and then you implement the selected options, and then you evaluate. Okay, so I'm gonna just tackle problem solving, and I end my video right now. We have focusing. The problem solving is to focus. The focus of problem solving is for you to try to solve problems, including decision making. So decision making is something you use as a tool to try to solve a problem. So we have the try and error method. So you are trying this one, making an attempt to see if the best solution will come out of it. And this is used by staff. Even in surgical cases, we have the try and error method that they're just trying to see if this method is going to work out. We have the experimentation, the study problem using trial period or pilot project to determine best outcome. Will have greater probability of achieving best outcome if sufficient time devoted to the process. So this one is the experimental one. It's not a try and error. That means you are doing this one as a form of an experiment. So we have the purposeful inaction. So purposeful inaction is do nothing approach. This is used when problem is judged to be insignificant or outside a person's control. That's the do nothing approach. Now the steps involved is to define the problem as well, just like in the problem solving method. You define the problem, you gather data, you analyze, develop solutions, select and implement a solution, and then you evaluate the result. Now I'm going to end my video here. We are going to continue in another time. I do have a lot coming on with this. I have to talk about documentation with you guys on the NCLEX. They want you to be able to know how to document. So we are going to come and then we discuss about documentation and incident report. We are not leaving that out. We're going to come back and we'll have that done. So I will see you another time and catch you later. Be careful and do study. Try to remember your nursing process in all you do. Whilst you're studying the NCLEX, don't forget your nursing process. Get to know your nursing process off your fingertips so that you can always apply them when the